if you look and you really study how broken the system is, look at how many lawsuits there are against insurance companies. Look at how many bankruptcies have been caused because of medical debt. If you truly had the customer's
Yeah,
back
you're
and you
right.
cared, yeah, 60, I think in 2019, I believe, and I'm going to pull up my screen here so you can kind of see
Yeah.
right here. I'm going to share my screen here, but these are statistics here. This is kind of the tipping point.
Okay.
So the average individual in America paid 780 per month, and the average family paid 2,000 per month in the marketplace ACA health insurance in 2022. That was 2 years ago. Those
Yeah.
numbers have increased. In 2019, 59% of bankruptcies cited medical expenses as a major factor.
Wow. Hello and welcome to another episode of The Wealth Within Us. I am Michelle Blaze, and today I have with me Matt Mittelstadt, and he is on a crusade to fix our broken healthcare system. He is the CEO and founder of Heath Care Crusaders, and I'm so happy to have him with me today because I think, as many of us know, especially if you watch this channel, that our system is definitely in need of not just a repair, but probably maybe a bonfire.
Oh, that's funny. Yeah.
So Matt, tell us how you got into all of this. I mean, this is a big undertaking.
Yeah, absolutely. Yeah, no, it's a pleasure to be on your show as well. I really appreciate it, Michelle, and
Absolutely.
excited to share with your listeners what we're doing on this crusade. So, just to introduce myself, my name is Matt Mittelstadt. I'm located out of the Austin, Texas area, and a little back history on how we got here. I spent about 22 years in the real estate space, and about 4 years ago, somebody approached me and shared with me a large marketing arm that markets everything in the essential residential and business service space. And our large marketing arm that's been in business for 31 years actually added another essential service to their buffet of services. And they partnered up with a company that we can basically market. And it's a company that is disrupting the traditional broken system, which is our American healthcare system. And so, one of the things that really kind of a light bulb went on my head was, and why I kind of went from a very successful career in real estate was to this was because it's helping a lot of people. And I've always been one of those people that wants to help a lot of people. And if
Right.
I'm doing something, it has to make a difference. And one of the things that kind of put the light bulb in my head and realized I had a gift in my hands was me and my family, as a family of five. I've got three children, and me and my wife. My wife's a traditional business owner. She owns a hair salon, small business owner. And me being in real estate, we were 1099 contractors, and we were paying $1,684 a month with Blue Cross Blue Shield for a family of five.
Wow.
And when we flipped over to Impact, which is the company that we are on a crusade with, we went from $1,684 a month to $605 a month. So we saved
Wow.
$12,000 a year. And that's when I was like, man, I've got a gift in my hands. But
Yeah, that is
but
a chunk of change.
yeah, yeah. And the beautiful thing is when I went out and I used it and it worked better and felt better than traditional insurance, that's when I knew I had an industry disruptor in a
Yeah.
$4.2 trillion broken system.
Well, and it's like, I think the solution has to not just save people money, but it has to work because there's a lot of things out there that you can save money on. Doesn't mean that they'll necessarily work very well. So you've tried
Yeah.
and tested the system. And I just, for full disclosure, I have joined as well. Definitely, I think and one of the reasons I wanted to have you on is because I feel my show is definitely geared towards a lot of entrepreneurs, people looking to change their mindset around health and wealth. And I think you kind of tie both of those things in together very nicely.
Yep, absolutely. Yeah, no, we definitely have tied that in. And, at the end of the day, what we're doing is we're basically, if you had like a perfect world and the way that you thought that healthcare should work here in America and the United States, it works that way with what we're doing. And so it's super, super exciting to be able to help people save 30 to 70% on their healthcare. And I just want to kind of talk a little bit about, what it is, if that's okay, Michelle, just to kind of explain to
Oh,
you the
definitely.
backstory.
Yeah,
And
because I think we need to know is maybe there's some people out there that like, what are you talking about? My healthcare is great. I get everything for free. So I think definitely we need to address that, both all that stuff.
yeah, yeah. So I'm going to give you just a statistic here, and this comes from the U.S. Department of Health. Is 5% of the population is responsible for 50% or more of the annual healthcare spending in the United States. And what that means is, and what that translation is that there are way more people overpaying for healthcare
Yeah.
because of that for-profit model than there are people that, are sick and need it and things of that nature. So people are overpaying. And I was one of those people paying an
Right.
extra $12,000 a year, barely going to the doctor. And I think that's a lot of people barely go to the doctor, right? And
Yes.
yeah.
And
So
I think in America, at least, most people's health plans are either non-existent anymore. It's not like the corporate America of the 80s and 90s where, you got a good plan, you got a good health plan, a good pension. I know my dad, he was a union. He got great health insurance. He got a great pension. Those things don't really exist anymore. Those are kind of going away. So that's why I think what you're doing is so important.
yeah. And let me give you the backstory of what we're
Okay.
doing. And so, there's because of technology, okay, technology, you can agree with me, Michelle, it's really changed the way that we've been doing business,
Absolutely.
right? I
Absolutely.
mean, if you think about it, we're on this call, we're
Mhm.
utilizing Zoom, we're able to connect. Me and Michelle, we've actually never actually physically met, but we've built a
No.
relationship because of technology. But here's the crazy thing is that a lot of companies have been disrupted because of technology. You know, I Michelle, I don't know if you remember Blockbuster. You remember Blockbuster, and I'm sure a lot of you.
I do. I
Yeah,
am an Xer. I definitely remember Blockbuster on the
yeah,
weekends and
yeah, yeah,
isn't
and
that video gonna be there? Yeah, I remember
yeah,
Blockbuster.
yeah. I remember all the late fees I got from
Oh
Blockbuster.
yes,
Right?
that's right. Yeah, and it was Netflix, right?
Yeah. Netflix came in and actually disrupted that. Now, if we think about it really quick, and I want to give people perception here is that what's the difference between Blockbuster and Netflix? The only difference is technology and also a community approach. Same thing with Airbnb and the hotel
Yeah,
industry. What's the difference? You stay in a certain place. It's just technology allowed you to stay in other people's homes, okay, at a
yeah.
cheaper price than it is, being in a hotel. Same thing with, Uber and the taxi industry. What's the difference? You get into a vehicle and you go where you're going to go. What did Uber do? They came in, used a community approach, and used technology to make it better for the consumer. Same thing with Amazon. Amazon did the same thing. They disrupted the retail space by making it more convenient because of technology, but they also used a community approach. And that's what we're doing with the healthcare industry. So, to give you a little backstory on how we're doing that with technology, is there's a concept that that's been around for 30 to 40 years. And if you're listening here today or you're watching, the concept you might have heard of, you might not have heard of. Usually, when I speak with people, it's usually a 50-50. And the concept was called health sharing. And health sharing has been around for 30 to 40 years, but it's always been in the religious based communities. So
Mm.
only one group of people could partake in it. But about 6 years ago, the government stepped in and said that health sharing organizations are a proven concept, but they should not just be religious based, they should also be ethic based, where everybody can partake in it. And when that happened, and they made it ethic based, where it didn't matter your race, your religion, your color, nothing of that nature. When that happened, the CEO and the president of one of the largest health sharing organizations in the world, a company named Medishare, which has about 400,000 members across America on the religious based side, they pay out about $50 million in claims a month. They have a 98% satisfaction rate with their customer base. The CEO and president of that company stepped down when they found out it could be ethic based, and they said, hey, if we can build out technology to make a health sharing organization work, feel, and touch exactly like traditional insurance, then we will disrupt that $4.2 trillion industry. And that's what they did with Impact. So we have the patented technology. We have 9 patents, okay, that literally makes it work, feel, and touch just like traditional insurance. And if your listeners are listening right now, what do I mean by that? Well, see, traditional health sharing, even to today, if anybody's listening to this and they've maybe tried health sharing out in the past, or maybe they're using it currently now, one of the biggest problems is when they go to the doctor, they have to pay for their medical expenses up front. And then what they have to do is they have to take those medical bills, those super bills, and actually send those to their health sharing organization and then wait to get reimbursed. So it's a very non-convenient factor with that. Well,
and
these
it's
two
still money out of
gentlemen,
pocket for
yeah,
a
yeah,
time.
exactly. And these two gentlemen built out that patented technology to where it works just like insurance, where we just go to the doctor with our card, we pay a copay, the bills are electronically processed. And the beautiful thing here, Michelle, is that because we're a nonprofit model, Impact is, we're saving people 30 to 70% versus the for-profit model.
Wow. Well, and that's a huge savings, I think, all around.
Oh yeah, 100%. 100%.
And and it sounds like it makes everybody happy. It makes the provider
Yeah.
happy that's billing. So they're getting paid. And I know in the past, there have been, certain physicians or doctors or networks won't take a certain insurance because of that exact same thing, because they haven't been getting paid.
Yeah, and that's a great point you bring up. So one of the reasons that makes us also very, very powerful and a solution to that broken model is we literally allow our members, we have a fully open network. So you can see any doctor, any surgeon throughout the United States. And the reason for that is because number one, we pay our providers in 15 business days on average. And then we also pay them 140% more than the Medicare rates. So we're paying them almost 3 times more than the traditional insurance companies. And that's because of our nonprofit model.
So one of the things that I really like about Impact is that I can go see my alternative health and wellness providers, such as maybe an energy worker. I can use a product that, maybe I'm paying for that's a supplement, or like the LifeWave patches, which I talk about on my show. So I can go do things like that. And maybe people that don't accept health insurance, but are still providing a service that is very beneficial for my health and well-being. So what I like about this is that I may look at health and wellness differently than other people, but I'm still going to get benefit by continuing to use those services.
Yeah, absolutely. And it's a beautiful thing that we're doing with that. We call it the health and wholeness credit. So we're the first healthcare company. Doesn't matter if it was traditional insurance or in the health sharing organizations that have been around for 30 to 40 years. We're the first one to release this. And what we're doing is we're promoting a community of wellness versus, in our opinion, the traditional insurance model has been, and the broken model has been promoting a community of sickness for decades. And
Right.
so what we're doing is we're rewarding people, okay, that are doing something for their wellness. And what we do is anything you do for your wellness. So let's say you have a gym membership. Let's say you have a Peloton membership. Let's say that you take vitamins or supplements, or you use any essential oils, or you go see a holistic doctor, or you do anything like the LifeWave patches, like you're talking about. Anything that you do for your wellness, even if you go and get IV drip bags and stem cells and acupuncture and red light therapy, or you do yoga, basically anything you do for your wellness, you're able to take whatever you're spending out of your pocket right now and take $100 a month per household and apply that towards your deductible. We call it a PRA, which is a primary responsibility amount, but it's the same thing as a deductible. And so $100 a month in 12 months, that's $1,200 that you're already spending this out of your pocket. You're not getting the credit for right now. That will come towards that whole house deductible, which we'll talk about here in a second. So we have what we call our whole house deductible. So one household shares a deductible. So like me and my family, we're on a $2,500 whole house deductible. If we do something as a household, at least $100 a month, That brings our whole house deductible in a year down to $1,300, which is a massive savings.
Especially when there's five of you and you've got young kids. So I know they usually have pediatrician visits or, well, they're prone to some
Yep.
bumps and bruises as well.
Yep. Yep. Exactly. So yeah, it's huge.
Yeah, that is, I do like that about that. And especially for my guests, what I introduce on here is a lot of people who are specifically in that space. And if I'm understanding you correctly, it doesn't matter if they take health insurance or not. It really doesn't matter.
Yeah, it doesn't matter. Anything they're doing for their wellness.
Now, say a naturopath doctor or a functional medicine doctor, say they were taking health insurance. Would the health insurance cover it since they're taking health insurance? How does that work?
No, they wouldn't, and they won't, Naturopathic doctors,
Okay.
insurance companies won't cover them,
Ah,
right?
okay. I see what
Yeah,
you're saying. Yep.
yeah. And so, but let's say you go to a holistic doctor
Mhm.
with us, you can take $100 a month and apply that towards whatever services you're getting from that naturopathic doctor, and you can apply it towards that deductible, that PRA.
Right. So I love that aspect of things as well. And I love the savings and I love that it's a whole family or a whole household of people that is covered at the same time. So
Yeah,
now that we kind of see what you're doing and what Impact is doing, like let's just talk a little bit about like why would people look at this and what is really broken? Because I think there's a lot of things hidden in our current healthcare system, especially, and maybe we need to touch on this as well as like the Medicare, Medicaid side of things. And I know there's also, if you are over 65, there's an option for you with this as well.
yeah, absolutely. And some other features just to kind of tell you,
Huh?
so every member gets free telemedicine where they can speak to a doctor in 15 minutes with no copay. And that doctor will prescribe them what they need. And they can do that virtually from home on the phone or through video. And they can go pick up those wholesale prescription pricing, which is another benefit. So if they do take any type of prescriptions, we give our members wholesale because we're a nonprofit. There's no profits built into it, which is huge as well. And there's huge savings on that. But on the 65 and older, okay, they most of the time are on Medicare A and B. All right. And then they'll probably get like a Part D for medications. If they're on Medicare A and B only covers 80% of whatever their cost is. So the senior usually has to get some type of supplement. Well, our
Mhm.
supplement is super unique because it's only usually runs around $100 a month.
Mhm.
Okay. And we've seen massive savings. We've seen people that are on supplements through traditional insurance and they're paying $200 a month. So saving $100 a month for a senior that's probably on a fixed income is a huge
Yeah.
deal. But then it's also only $1,000 max out of pocket on the other 20% that Medicare A and B doesn't cover, which is huge.
Yeah.
And no pre-existings matter with 65 and older.
Mm.
And and they also get they don't have to pay any copays. And if they have Part D, okay, with their Medicare A and B, whatever they pay for their prescription costs, they can submit to Impact, and Impact will reimburse them. So super powerful for the seniors, and then also being able to choose the doctor that they want to go see, and not being a network. And
Right.
um,
Do like
they,
that aspect as well, the whole
yeah,
open network thing. And just as a scenario, how would that play out? Because I specifically know someone who was out of town and had uh, something catastrophic happened. So they were able to go, but now their medical bills are like, because it was out of network, it wasn't in their local area, they were out of town. So how does that work? And then that's devastating. I mean, that's a big financial burden.
yeah. So they can choose any doctor, any surgeon throughout the United States. So they don't have to worry about traveling. They don't have to worry about any of that. And if they're out of the country,
Mhm.
as long as it's emergency, they can use it as well. They just pay whatever
Oh,
they're
okay.
requiring for them to pay out of the country for emergency purposes only. When you're out of the country, then you can just pay whatever they're asking to pay, and then you can actually grab whatever medical bills that they have and you can submit those directly to Impact like the old school way, and they will bill those people and they will reduce those prices for them as well, and it will go towards their deductible as well.
Yeah, I definitely like that travel aspect because I mean, I've heard of people that they're like leaving on vacation early because something's going wrong because they don't want to be stuck with huge out of network medical bills. So I think that's
Yep.
another major benefit. So it really is kind of like very open. You don't have to pick where you go. I think years and years and years ago, when I first started in the workplace back in the 90s, I think I was part of like a Kaiser Permanente, weren't they? That was like shared, but you could only go to like, it was so limited.
Yeah, that's out in California is really big. Were you in the California market or no?
No, I was living in DC.
In DC? Yeah, Kaiser's really big out in the California market. We have a lot of
Okay.
customers in the California market because at the end of the day, they don't like what Kaiser makes them do. But being able to choose any doctor is huge, and
Yeah.
not, traditional insurance companies will have what they call as PPOs, right? But most people are on HMOs because it costs too much to be on a PPO, right? The HMO is already expensive enough, and the PPO lets them go to the doctor they want to go to, but they charge them more for it, right? And so most people are on the HMO and they're still paying too much. And with us, we call it medical freedom, being able to choose the doctor that you want to go
Yeah.
see. And so, yeah.
And that's exactly what I like. I sort of like to tiptoe outside in this parallel economy here that I believe we're all creating.
Yep. Yep. Absolutely.
So, in regards to other health insurance companies, are most of them for profit?
Yeah. So, if you use Google and you type in, what did the CEO of Blue Cross Blue Shield make last year? Right. It was over $15 million.
Yeah.
Right. So they can inside there's people that are getting paid. Right.
Right.
When you pay your monthly premiums, okay, where do those monthly premiums go?
Mhm.
They go for profits and investments, right? They go to pay the CEOs and executives. They go to pay the employees of the insurance companies. Then they go, and the last people they pay are the doctors' offices and clinics.
Mm.
And that's why they're always fighting. And again, if they cared about the people like they should,
Yeah.
then and they cared about even the doctors and the hospitals that are doing the work,
Mhm.
okay, the reason that they're always upset with the insurance companies is because they're always fighting them to get their payments, but they're getting paid less because these insurance companies are taking more money from them.
Mm. Because of their for-profit model.
Yeah, because of the for-profit model. Somebody's making money, right?
Yeah.
And profit's not a bad word. So I don't want to say it's a
No.
bad word. Profit's a good word, but when it's used the wrong way. Like if you
Yeah.
look if you look and you really study how broken the system is, look at how many lawsuits there are against insurance companies. Look at how many bankruptcies have been caused because of medical debt. If you truly had the customers
Yeah,
back
you're
and you
right.
cared, yeah, 60, I think in 2019, I believe, and I'm going to pull up my screen here so you can kind of see
Yeah.
right here. I'm going to share my screen here, but these are statistics here. This is kind of the tipping point.
Okay.
So the average individual in America paid 780 per month, and the average family paid 2,000 per month in the marketplace ACA health insurance in 2022. That was 2 years ago. Those numbers have increased. In 2019, 59% of bankruptcies cited medical expenses as a major factor.
Wow. I'm
So
not surprised, actually.
that's what we're dealing with, and again, I'll go back to the truths about healthcare. 80% of Americans right now in America are looking to lower their healthcare cost. And again, back to that statistic, 5% of the population is responsible for 50% or more of the annual healthcare spending. And that basically means that people are overpaying, and over 100 million Americans are in some type of healthcare debt.
Okay.
And
Which I'm
and
not
and
surprised.
yeah, and the reason for that is the medical bills are 450% to 1,000% increased in profits, right?
Okay.
So when you go to the doctor and you say, let's say you're there for 2 hours and the bill's 10 grand, it wasn't 10 grand, right? Those were all the profits, okay, that are going to the insurance companies. So I'm going to give you a couple examples here. So we do
Yeah,
something that,
I think we do need examples to explain this. I think this is the
yeah,
part that a lot of people probably don't understand, and
yeah,
myself included. It's all. I think they make it confusing for a reason.
yeah, yeah, absolutely. So we do something that's called reference-based repricing.
Okay.
So we take each medical bill and we reprice it down 72% in savings. So
Okay.
this is a copy of a customer's bill here that was the charged amount was $5,700. Okay. Impact came in and repriced that bill down $5,130. The leftover amount that the customer owed was $620. Now, with traditional insurance, they would have never saved them that money. That money would have gone to profit and they would have been stuck with a larger medical bill, maybe had to go on a payment plan, something of that nature. Now,
Yeah.
here is another bill. Okay. This is a larger bill, and the bill was $200,000. Okay. Impact brought that bill down. Okay. Down to, they saved him $179,000. Okay. And then the leftover amount, okay, that was due to the actual that was due to the hospital, the 13,000 was shared in with the community. And so the member's responsibility on this was $6,517 that went towards their deductible.
Okay.
Pretty powerful, right? Off of a
That is.
$200,000 bill.
And if the deductible, like you said, if you had gotten your deductible down to $1,300,
Yeah.
with all the
And
other stuff.
I'll go over those deductibles here in a second, but let me show you a couple other repriced bills here. So this right here was $37,000. Impact saved them $23,000. And then the amount that the customer had to come out of pocket, the $12,000 was shared in with the community. The amount the customer came out of pocket was $1,400, which is huge, a huge
That's
savings,
huge,
another
huge.
huge savings. Here's another one here,
And these
which
are-
was $223,000. Impact saved them $209,000, and then $14,000 was what was left over. Now, let me go ahead and show you those numbers that are left over or what goes towards the deductible.
Okay.
Let me show you how we do our quotes here, so
Okay.
people can understand. So we don't base our quotes off of the income of somebody like traditional insurance. We base it off of the oldest person in the household's birth date. So as you can see here, this person was born in 1969. They have a family of 5. All right.
Okay.
They're paying $628 a month on a $2,500 whole house deductible.
Wow. So that's not even individual. That's like all together with those 5.
That's the whole family. That's a family of 5, which is a huge savings there. Now, this individual that was born in 1969, they would actually have 4 choices. And based on their deductible that they pick, if you look here, the primary responsibility amount was, which is the same thing as a deductible, was $2,500. They pay $628 a month.
Okay.
But if they chose a $5,000 deductible, they pay $571 for the whole family.
Okay.
If they chose a $7,500, $513, $10,000 would be $456.
Yeah. So you do have more choices then.
Yep, you have more choices than just the 25. But whatever that, back to the reprice to the bill, whatever that bill comes down to, whatever's left of that bill, it goes towards the deductible.
Okay.
And remember, that's a whole house deductible.
Right.
So when the whole family, when there's been enough medical bills that have met that $2,500 deductible in a 12-month period, what happens is then it goes to a 90-10 split.
Okay.
So any other medical bills that come through after the repricing, Impact covers 90%, and then you pay 10%, and that 10% is capped at $5,000 for the year for the whole household. So on a $2,500 deductible, no ifs, ands, or buts, the max out of pocket for the whole family would be $7,500 for the year.
Right. Yeah. If you had medical bills that high.
Yeah. 87% of Americans never meet their deductible from year to year.
That's an interesting statistic. Yeah.
Yeah. I've been on Impact for over 2 years on a $2,500 deductible, paying $605 for a family of 5. We've never met our full deductible. And that's how most Americans are, is because of the fact that, you hardly go to the doctor. It falls
Right.
into play with that 5% of the population that
Yeah.
are responsible for 50% or more of the annual healthcare spending.
Yeah, that makes so much sense. Oh my gosh. Yeah. So,
Yeah.
I mean, I think it's that out of the box thinking that has brought impact where it is today. Just like the other companies that we were talking about, with Netflix, with Blockbuster, and,
Yep.
you mentioned all these other factors as to why Blockbuster is no longer in business, is somebody was out of the box and presented a situation that was actually solving, or presented a solution that was actually solving the problem. Because I think most of these are just like Band-Aid solutions that we're looking at.
100%. And the funny story about Netflix and Blockbuster is the CEO of Netflix went to Blockbuster and said, "Hey, I think we can team up together. You have a large company. Here's my idea." And he said, "Nobody will never want to be able to not come into the store, touch, feel the video, and walk out with it. It'll never happen." Well, you can see Blockbuster is no longer there, right? Same thing happened with Uber. If you watch, there's a movie on Uber, and in the movie, and you might even know the story, but Mark Cuban, was approached, by the founder of Uber, and he said, "There's no way it'll work." And he still to this day, him and Kevin Hart, still to this day say that was the biggest mistake that they ever said.
They
And
said,
that they never invested in. It was the biggest investment they never invested in because they didn't think it would work. They didn't think that, that they could disrupt the taxi industry. Well, I've been on this crusade for over 2 years. And I know for a fact in the next 12 to 24 months, Impact will be a household name.
yeah. And especially if they're paying their bills.
Yeah. 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 And to give you a statistic on that, just so you know, so this is how proud we are about paying our bills is we've actually never missed a medical bill. And back in April of this year, we were actually featured by Yahoo Finance, where we surpassed over $15 million in medical bills. We've actually never missed a medical payment. We've also never let a customer go to collections, nor will we ever let that happen. And that's because we are focused on the people versus being focused on the profits.
Right. And I think what else I like, and I know it's kind of buzzword-ish, but I think it has a lot of merit, is that people are looking for medical freedom right now. And I think people are looking for freedom in general. And I'll get on my own little soapbox. Like, I just feel that too many people are dependent on the government for all of their services, which then pigeonholes them into, because correct me if I'm wrong, but if you're on like state insurance or things like that, you're very trapped in a network-based system.
100%. Yeah, 100%. You're trapped in that system, and people just need to know there's a better way. Yeah. And as technology keeps expanding, there's going to be better ways to do things, and it's not going to be your normal people that create them. It's going to be your Albert Einsteins of the world, right? Your people like Henry Ford that created the vehicle. Like all of these people, these are the next generation of people, the Netflix, the Ubers, the things of that nature, for generations behind us that are going to go, these are the types of people that are in the history books, right? Mm-hmm. And that's what we're doing. We're changing a $4.2 trillion broken system.
Well, I love what you are doing. And I think there are so many opportunities because truthfully, there's a lot that's broken right now.
Yeah.
So if you're one of those people, get on it, because I think there's a lot of people out there searching for better solutions than what's being offered right now in the mainstream. And I think Impact Healthcare, and I think you yourself as a crusader on this path, is just inspiring others and getting people out of those broken models and saving people a lot of money, and especially entrepreneurs. I know a lot of entrepreneurs who are paying a lot in their health insurance. And it's especially a lot when you look at your statistic that you said. What was it that you said? 87% of Americans never reach their deductible?
87% of Americans never meet their deductible.
So you're paying thousands of dollars a month and you're never even meeting your deductible on top of it. And you're probably leery every time you want to go somewhere as well. Like, oh, do I want to go? Do I not want to go? Nah, I'll just take care of it myself. Which I know I fall into that category.
and to give you another perspective, so 2 years ago, over 2 years ago, I became an Impact member and kind of went on this crusade. And I told you before we were spending $16.84 a month, right? People that are same family of mine now that I'm meeting with today, for a family of five, that were in the same space that I was in the real estate space, which, real estate agents make good money.
Mhm.
They're paying over $2,500 a month. That's what their premiums are coming in at this year for that same family of five. So look at the increase over 2 years. Like, where would I be? Like, I would be paying, that's pretty close to my mortgage payment, right?
Right. Yeah.
And some people, depending on where they live in the United States, that could be two mortgage payments, right?
Mhm.
So that when you can take and put, like myself and many others, thousands of dollars back in people's pockets on the second largest bill in the household, it's super powerful. Like, you have a calling to do that, and that's what we're doing on this mission.
No, I do. I love that. And especially I think it kind of goes to that, the middle class, and I would even say the lower class, like there really is a great wealth transfer taking place, and we need to take our power back in those as the people, I would say, almost.
Yeah.
And stop giving our money to people that don't really need. Like, what are you doing for $15 million a year? Because I'm thinking I probably work a lot harder, and I'm probably a lot smarter too.
I'm telling you, like, and it's funny because before the light bulb went on my head, I didn't understand. I just knew that, hey, I had to pay it or I wasn't going to go with it. But it's crazy when you start Googling, what does the United Healthcare CEO make? What is, this or that? You're like, holy cow, that's where all of our money's going, right? Like,
Yeah.
what are you really doing for that? And so, yeah, we're definitely making a difference.
Yeah.
And
And I'm sure you don't even want to follow the money trail on that, because that would probably get a little bit even more
yeah,
frightening.
we could go down the rabbit hole with that one. You know what I mean? So
Yeah, exactly. And I don't, and I'll keep my mouth shut.
yeah, yeah. It's okay. I
Yeah,
have ID seal on my camera, and so they
there
can't
you
hear what
go.
I'm saying. Okay, so we're good.
But no, yeah. So I think that's definitely a rabbit hole you are welcome to go down, for the people listening. And I'm sure you'll be quite shocked as to what you find. And I do love the nonprofit status. And it does seem like they really are giving a lot of their money back to the members, which is what health sharing is supposed to be about. And I remember last year, I think it was, even just with my auto insurance, see, they need to break the auto insurance industry as well.
Yeah, we need to break that, definitely.
Yeah, definitely. And my rates went up significantly. I think it was like 25-30%. And I call them like, I don't understand. There's like no accidents, no nothing on this. Well, why is this going up? And literally the person on the phone said, well, there have been a lot of accidents in your state, so now everybody has to pay for that. So there was a blanket increase to everybody in your state. And I said, well, I'm not paying their insurance and I didn't cause any accidents. So, yeah.
Yeah, what's funny about that is mine went from like 240 for two vehicles, right, up to like 400 and something, and I called them too, and they're like, yeah, that's just how it is, and I called State Farm, okay, and I'll give them a shout out here because they brought me back down to that 200, and they also put something on my car to where they can show that I'm driving safe, and they give me credits back, and so I'm like happy with State Farm.
I did the same thing. I called somebody else. Yeah. I was like, yeah. And that's the thing. It doesn't create loyalty. And I get that healthcare is a lot different. It's a lot more, I think, stringent. And I guess, I don't know, are there a lot of options when it comes to healthcare?
Yeah, I mean, there's tons of insurance companies out there, but I'll tell you one thing that's super powerful is that and if you're a doctor or in the medical profession and you're listening to this show today, I want to tell you that one of the things that doctors really want to do is they want to be able to practice medicine the way that they want to practice it, right? Like if I meet with a doctor, whether it's a holistic or whether it's a regular MD, and they tell me I need this certain, medication or I need this certain surgery, what happens is when they go to get it approved through the insurance companies, they can deny that person from getting it until it gets worse. Like they won't cover it.
Right.
I've heard of stories where they're like, "Hey, this guy needs this or he's going to die," and they're like, "Well, no, let's just wait and see what happens," and then they die. Right? There are scenarios like that. I've heard stories just from talking to people. But here's where impact comes in again for the providers. If you say that something needs to be done, we let you practice the way you want to practice. We don't.
Oh,
There is no approvals with us, so you don't have to get an approval if you need something done like an MRI or something like that, and they need it done that day. There's no, oh, we got to wait, get approval, and we'll come back. And hopefully your knee doesn't get screw up more than it already is when we should have already
yeah.
had the MRI. So impact allows, you just give them a call. There's a number on the back of the card. They say, go ahead and get done whatever needs to be get done. And you're good to go. You get it done that day versus having to wait for these approvals and
Yeah.
things like that. And
Well,
that's why go ahead.
oh,
Sorry.
no, I would also assume I've experienced it with my own family members that it's also true on the other side of things. You've already had something, say you broke a leg or whatever, and now you need some physical therapy on the opposite side of things. So after the thing has been done and getting approved for that stuff when it's clearly needed has been wow.
Yeah, no, not with us. We allow them to. I mean, that's why we have people that are like, for instance, I was on a call the other day. We had the Texas Association of Chiropractors. Okay. They partnered up with us on this crusade to offer to all their chiropractic offices. It's because we're letting them basically practice the way that they want to practice. If they think there's something, so yeah, it's huge in the doctor community. We have holistic doctors that are on this crusade with us, right? We have MDs that are on this crusade that are offering it to their patients, being like, "Hey, listen, this is a better option for you. You should check it out." So it's pretty amazing.
Yeah, well, you truly are on a medical and health freedom crusade for sure.
Yeah,
So
exactly.
how do people learn more information? How do they sign up? How do they get a quote?
Yeah, absolutely. So we have a couple things. If you want to review some testimonials and things like that, there is a YouTube channel called Heath Care Crusaders, okay, that you can go to, where I started that channel where I have recorded testimonials from patients that had cancer, where impact came in for the win, all kinds of different testimonials on savings and things of that nature. But if you want to get a quote, okay, you can go and there is a link, and I'm sure you can drop the link somewhere for your viewers.
Yeah, all this information will be in the descriptions on whatever
Perfect.
platform that you're watching this on.
Perfect. And when you go and you click on that link to get a free quote, you'll see where it says get a quote. And all you do is put in the oldest person in the household's birth date. And then there's 1, 2, and 3. So if there's 3 or more in the household, they pay the same amount. So you just click 1, 2, or 3 in the household, and it always goes based off the oldest person. And then those 4 choices that we shared earlier will pop up. And then those would be your choices in your premium. And if you decide you want to enroll or you have any questions or anything of that nature, I can give you my email and she can put it in the chat as well. It's healthcaredisruption@gmail.com. And then also my phone number as well. We can put that in chat as well.
Awesome. And the other thing, just to note, when you're putting the oldest member in, it's the oldest member that's not on Medicare, Medicaid, correct?
That's correct. Whoever's the oldest person in the household, right? If they're on Medicare A and B, they're over the age of 65, they just put in their age, right? Same thing with an individual. If they're just an individual and they don't have any family, they just put in their birth date.
Okay.
If it's 2 or more, that's where you put the oldest person.
Okay. But if you're over the age of 65, then you just go for the supplement.
You just put in your birth date for somebody that is older than 65, and then it'll pull up with the supplement.
So it kind of thinks automatically. It says, "Oh, okay, well, you don't need this. This is
based on the age." Yep.
Okay, perfect. Exactly. And I'm sure there's all kinds of information and fine print and all the other good stuff there. Or like, as you said, you've been so helpful in helping people, and you can sort of answer any questions that people have along the way, because I get it. It's new, it's different,
Yeah.
but not really. It's been around for
Yeah.
30 years. It's just more catching on in a more,
It's we're the most modern with technology health sharing organization that is ethic based, where everybody can partake, and it works, feels, and touches just like traditional insurance on the convenience factor. We're just saving people 30 to 70% because of our technology and our nonprofit model, and it works better and feels better than traditional insurance.
yeah, I already feel better.
Exactly.
Well, is there anything else you would like to leave us with? I mean, you are on a crusade and you do have a platform here.
Yeah, no, I would just say that if you're out there listening to this, number one, subscribe to Michelle's channels, whatever channel,
Oh,
because
well,
she
thank
does,
you.
yeah, she does amazing things to help people. And if you're somebody out there that just wants to take a look at it and see if it would fit you and your family, I would say just go ahead and take a look at it, because literally putting thousands of dollars back in your pocket is a huge deal on the second largest bill in the household. But also, if you're somebody out there that, likes to help people and you want to make a difference in the world, please reach out to us. We're always looking for other crusaders that want to go out there and make a difference and be a part of the team. So we'd love to talk to you about that as well, to go help others as well.
I love that. And I would consider myself a crusader now as well.
You are a crusader. Yep, we're on this crusade. We can't do it alone. So
No,
there's a large world out there, and we have the opportunity to go out there and help a lot of people.
yes. And I imagine that the future for Impact is only getting brighter as the technology improves. I'm sure Impact,
Yes.
like, it will improve right along with it. Oh,
Yeah.
the other thing that I did want to mention real quick that we kind of didn't mention, but I want to quick put it in there for anybody who's going to click that button and check it out, is the vision and the dental.
Oh yeah, yeah. So one of the things that we do is we give back to the members with that health and wholeness credit, and we're able to do that because of our nonprofit model. Instead of investing that money into CEOs and executives, we invest it back into the community. So we have free dental and vision. Okay, it's a dental and vision discount program through one of the largest networks called the Carrington Network. And you're able to get, it's like 30 to 60% discounts off of dental and vision. And that comes absolutely free. There's no extra charge for you as well. Yeah. So really quick, I wanted to give you kind of where we're at and where we're going. So the concept of health sharing been around 30 to 40 years.
Right.
The two gentlemen that I explained before that, helped Medishare go from 200,000 members to 400,000 members, and Medishare has been around for 30 years. Those two gentlemen are the ones that created this patented technology with their experience in knowing what needed to be fixed and what could disrupt that industry. When I started on this crusade about over 2 years ago, we were at about 1,500 members. Okay. And today we sit at close to a little bit over 15,000 members across America. And so in a 2 year span, you can see the growth. We are projected based on what we're doing within the next 12 to 24 months, being well over 100,000 members. And that's in a very short amount of time. It took Medishare over 30 years to get to 400,000 members, because remember, they had one group of people, which was the religious based community, and there
Right.
were lots of restrictions as well. So imagine where we can be, okay, and how much we can change in a very short amount of time. And that's due to the technology we have and it working, feeling, and touching, just like traditional insurance, just not having the high cost factor.
Yeah. And putting money back in Americans' pocketbook.
Yep, exactly. Yep. And we definitely need that nowadays with with $100 doesn't go very far in the grocery store anymore.
No, it does not. But if you look at all your expenses and if medical is at the very, very top, I definitely urge you to take a look at this. I did.
Yeah.
I became a member, so I'm proof right here. I'm not trying to talk about something that I'm not doing myself.
Yeah. And the last thing, Michelle, is 27. This is another statistic. 27 million Americans are uninsured. And it's not because they want to be uninsured. They've gotten to the point where they can't pay that second largest bill in the household. It's either put food on the table or not put food on the table. And they're going to put food on the table. But they're on what I call as the hope and pray plan. Hope and pray doesn't something happen. Oh, and the last thing I want to mention. So if you're listening to this and no matter what your political views are, even though we're coming into an election next week, this is not political, but there are millions of immigrants here in the United States. And if they don't have a social, it's very hard for them to get traditional insurance. So they're on that hope and pray plan. And we can actually help people. We're taking the handcuffs off for the immigrants that have what we call as an ITNI number, which is a tax identification number. It means they work here in America. They just don't have that social yet. They're working towards that. They have a government issued ID. They do pay their taxes. And if they have that, we can help them get the same American healthcare that me and you can get. And there's millions of those people we can help get off the hope and pray plan. And so that's a huge, huge thing that we're doing as well.
Yeah. And those are the people that came in here legally and are doing it the right way. And
yeah, they're doing it the right way.
Not for a better life.
Yeah. Looking for a better life. They work here. They pay their taxes here. But they're penalized because they don't have that social yet.
Gotcha. Well, that's good to know. And if you are one of those people, definitely reach out and see how Matt can help you as well. Oh my gosh. Well, thank you so much. Thank you for being a crusader, especially on such a topic as healthcare, because it doesn't matter if we're healthy or not. It's like, it's kind of always in our life. You know, we're always trying to take care of our wellness in whatever way that feels right to us. And I'm grateful that Impact allows people to do that without judgment, because I think a lot of the other health insurance out there, they don't want to deal with or even consider any alternative stuff. So I'm glad that holistic health and wellness is on Impact's plate. And I'm hoping for a bright future with that as well to benefit more and more Americans.
Absolutely. 100%. Awesome. Thanks so much for having me on the show. Appreciate it, Michelle. And you have a wonderful day, and we'll talk soon.
Absolutely. And thank you so much for being on. And maybe we'll have you back if things change and we, have some updates and all that other kind of good stuff. But for now, this is Michelle Blaze, and you've watched another episode of The Wealth Within Us. Thank you. Right now, you can begin aging gracefully, full of energy, vitality, and overall wellness. But as time goes by, our bodies can start to show signs of aging. Until now, introducing LifeWave X39, the world's first product that activates our own cells. This breakthrough in regenerative science helps restore our bodies to a healthier, more youthful state. X39 uses patented phototherapy to elevate a copper peptide that signals cellular activation. Think of it as your internal repair system, generating younger, healthier cells that can rejuvenate your tissues and organs. Just one X39 patch applied daily is all it takes. Safe, non-invasive, and backed by clinical studies, this is your chance to regain control over your vitality. Don't miss out on the future of anti-aging. Experience the power of X39 today. Visit patchedlight.com and start living younger now.